we are going to see the muscles of gluteal region. So before going into the proper topic, let's understand the features that is present in this anatomic model from this view. So this muscle which is present over here, actually they are a single muscle, that is the erector spinae, and they have different parts, depends on the attachments. So generally we have to remember this region as the aponeurosis of the erector spinae muscle. This bone over here is the ilium, this is the ischium, and this is the pubis. Together they form the hip bone. And this will be the right side of the body, and this is the left side of the body. This muscle here is the gluteus maximus muscle of the right side. So it is the largest, most coarsely fibered and most superficial gluteal muscle. It is quadrilateral in shape. You can see the shape very clearly from this aspect, and it covers all of the other gluteal muscles except the anterosuperior part of the gluteus medius. That is the region, this is the region of gluteus medius which is not covered by the gluteus maximus muscle. This is the region. Now let's look about the origin of gluteus maximus. So for better understanding, I have not included the gluteus maximus of the left side so that we can see the bony attachments very clearly. So if you look very carefully over this region, you can see the muscle arises from one, the posterior part of gluteal surface of the ilium above and behind the posterior gluteal line, that is from around this region. Then outer sloping surface of the dorsal segment of iliac crest, that is this region. This is the area of the iliac crest, and that is the origin point of gluteus maximus. Next one is the aponeurosis of erector spinae muscle. We can see the aponeurosis of erector spinae muscle over here, and a part of the muscle over this region is arising from the aponeurosis itself. Fourth one, the dorsal surfaces of the lower part of the sacrum, that is around this region of the sacrum, and adjoining part of the coccyx. So this region also will be giving rise to the muscle fibers of gluteus maximus. Lastly, we have the sacrotuberous ligament. This is the sacrotuberous ligament of left side. We can see the origin of gluteus maximus from the sacrotuberous ligament. Now let's look into the insertion. When you look at the insertion point, you can clearly see it is more visible from the lateral aspect. So this fiber will be the iliotibial tract, and this area of the femur will be the gluteal tuberosity. So it's clearly shown that deep fibers of the lower part is inserted into the gluteal tuberosity over here in the femur, and three superficial and deep fibers of the upper part is inserted into the iliotibial tract, which in turn inserts itself on the lateral condyle of the tibia over here. This is the region of insertion of iliotibial tract on the tibia, and this muscle is supplied by the inferior gluteal nerve, gluteus maximus. And if you look at the actions of gluteus maximus in a nutshell, it is the chief extensor of the hip joint during standing up from the sitting position and climbing upstairs. Also, it plays a very important role in rising from a sitting position and maintaining the erect posture. Next muscle of the gluteal region, that is lying deep to the gluteus maximus, will be the Gluteus Medius. We have seen a portion of the Gluteus Medius already, which is not covered by the Gluteus Maximus. So Its posterior one-third is deep and covered by the gluteus maximus, while its anterior two-third, that is this region, is superficial and not covered by the gluteus maximus. If you look at the origin, for better view, we have to remove the gluteus maximus from this model, anatomy model. So here is it. The gluteus medius, it is a fan-shaped muscle. It arises from the gluteal surface of ilium between the anterior and posterior gluteal regions. So if you look at the ilium over here, the anterior gluteal line will be around this direction and the posterior gluteal line will be from this direction. So in between them, all this area will provide the attachment of gluteus medius. If you look at the insertion of gluteus medius, the muscle fibers, they converge over here and they pass downward, forward. As you can see from the lateral view, it is passing forward and it passes laterally to form a flat tendon which is inserted onto the oblique ridge on the lateral surface of the greater trochanter. So this is the region, this area will be the region of the femur which is known as the greater trochanter. So for better understanding, we will be looking at the side where no muscles has been shown. So this is the area of greater trochanter. So the insertion of gluteus medius is located at an oblique ridge on the lateral surface of the greater trochanter, and this oblique ridge runs downward and forward from the tip of the greater trochanter. Between the tendon of gluteus medius and lateral surface of the greater trochanter, which is deep to this region, there lies a bursa, and that is known as the trochanteric bursa of gluteus medius. The nerve supply of the gluteus medius is by superior gluteal nerve, and if you look at the action of this muscle, it is the main abductor of the hip joint. Next muscle over this region will be the gluteus minimus. In order to see the gluteus minimus, we have to remove the gluteus medius from its entirety. So here it is. This is the gluteus minimus. Its origin is from the gluteal surface of ilium between the anterior and inferior gluteal lines. So as earlier, the inferior gluteal line will be extending from here to the anterior inferior iliac spine, while the anterior gluteal line will be extending around this region. So this much region will be giving rise to the origin of gluteus minimus. If you look at the insertion of gluteus minimus over the right side, you can very well see it is also inserted over the lateral aspect of greater trochanter, but a little bit anterior than the attachment of the gluteus medius. So here it is. This is the attachment of gluteus minimus, and it is a little bit anterior to the attachment of gluteus medius. It is attaching over here. This is the attachment insertion. The muscle fibers of the gluteus minimus, they converge downward and slightly laterally to form a tendon which is inserted onto the ridge in the lateral part of anterior surface of the greater trochanter. So between the tendon of gluteus minimus and the anterior surface of greater trochanter lies a bursa, and that is the trochanteric bursa of gluteus minimus. Earlier it was the trochanteric bursa of gluteus medius, that was between gluteus medius and lateral surface. So when you look at the nerve supply, this muscle also supplied by the superior gluteal nerve, and it is also helping in the abduction of the hip joint. Next muscle of the gluteal region is the tensor fasciae latae. We can clearly see the muscle fibers over here. And this is the muscle of the gluteal region, but during evolution, the tensor fasciae latae muscle had migrated to the upper lateral aspect of the thigh, but remains its nerve supply from the gluteal region, that is superior gluteal nerve. As you can see, it tenses the fasciae latae and iliotibial tract, which is located over here, thereby supporting the femur on tibia during standing position. Now we will move on to see the other minor muscles of the gluteal region, and these are 6 in number: piriformis, superior and inferior gemelli, obturator internus, quadratus femoris, obturator externus. We will be seeing one by one. First, we will see one of the important muscle of the gluteal region, and it is known as the key muscle of the gluteal region. But before going into that, let's understand this view. So in this view, this is the sacrum, and this region will be the middle 3 pieces of the sacral vertebra. Here is the spine of ischium, and the notch above that will be the greater sciatic notch, and the notch below the spine of ischium will be the lesser sciatic notch. And here it comes. This muscle is the piriformis, which is starting from within the cavity of the pelvis. That is, its origin is from the pelvic surface of the middle 3 pieces of sacrum by 3 digitations. You can very well see the attachment of piriformis over here. Now where it is inserted? It is passing through the greater sciatic notch for the time being. Actually, it was converted to the greater sciatic foramen by the ligaments of gluteal region, and this muscle is passing through the greater sciatic foramen. Now, for the better understanding of the insertion, we have to look for the posterior aspect, posterior view. So here it is. This is the region of the greater sciatic foramen in this diagram, and the muscle is coming through the greater sciatic foramen, and that will be inserted over the, we have seen this part of femur already, and this region is the tip or apex of the greater trochanter, and it is supplied by ventral rami of S1 and S2 spinal segments, and as the insertion attachment signifies, it is a lateral rotator of the thigh at the hip joint. Before seeing the next key muscle, important muscle of this region, we have to identify the location of the obturator foramen from this diagram. So this is the region of obturator foramen. Over the left side, it is more clearly seen. And now we can introduce our next muscle, minor muscle of this region, that is the obturator internus. So here it is. This is the obturator internus of the right side. So its origin is from the pelvic surface of the obturator membrane. The obturator membrane of the left side has been shown over here. So this muscle, that is the obturator internus, which is a fan-shaped muscle, takes its origin from the pelvic surface of the obturator membrane and the surrounding bones of the, which is forming the boundaries of obturator foramen. That is the origin. Now what happens to the muscle fiber? And after origin, this muscle will actually move out of the pelvic cavity by winding around this structure of the ischium, and that is known as the ischial spine. After winding around the lower part of the ischium, this muscle fiber will be inserted over this region, and that point is the medial surface of greater trochanter of femur in front of the trochanteric fossa. And this muscle is supplied by the nerve to obturator internus, and as the attachment indicates, it is also a lateral rotator of the thigh at the hip joint. Now we can add our other two muscles which are lying superior and inferior to the obturator internus, and they are the gemellus superior and gemellus inferior muscles. Here they are. This muscle over here, that is the gemellus superior, and this muscle over here below the obturator internus muscle, that is the gemellus inferior. So you can clearly see the gemellus superior takes its origin from this region of the bone, and that is the posterior surface of the ischial spine. Gemellus inferior will be taking origin from this part of the ischium, and that is the ischial tuberosity. So it takes origin from the upper part of the ischial tuberosity over here and lower part of the lesser sciatic notch. So this or the left side, for better understanding, this is the ischial spine region. Below that you have the lesser sciatic notch. After that you have the ischial tuberosity. So the gemellus inferior takes its origin from around this region. Now the gemellus superior is inserted over the, you can see it is going into the medial surface of the greater trochanter over this region, and that will be inserted over the medial surface of greater trochanter along with the tendon of obturator internus, which is clearly shown here. Now it is supplied by the same nerve, that is nerve to obturator internus, and it is also a lateral rotator of the thigh at the hip joint. Next one is the gemellus inferior. We have seen the origin of gemellus inferior already, and the insertion is also similar to the gemellus superior. It is inserted to the medial surface of greater trochanter along with the tendon of obturator internus. So these three structures passing together for the insertion, and that is supplied by the nerve to quadratus femoris, and that is also a lateral rotator of the thigh at hip joint. Now we will move on to add the next muscle, that is quadratus femoris. Here it is. This is the quadratus femoris muscle, and this muscle, it takes origin from the lateral border of the ischial tuberosity over here. It is clearly seen. This is the point of origin, lateral border of ischial tuberosity, and it is passing laterally and it is inserted over this area. And actually this was the greater trochanter of femur. This is the lesser trochanter. In between them you have an elevated ridge, that is the intertrochanteric crest, and within the intertrochanteric crest or one point you have one tubercle over there, that is known as the quadrate tubercle. So the insertion of quadratus femoris muscle is towards the quadrate tubercle over this region and the area below it, that is shown over the right side along this region, and it is supplied by the nerve to quadratus femoris. It is also a lateral rotator of the thigh at hip joint. So these were the major and minor important muscles of the gluteal region, and as you can see, none of these were visible except the anterior superior part of gluteus medius when gluteus maximus was intact. So all these structures will be present deep to the gluteus maximus muscle.